I've spent most of my life having no health insurance. I'm 34 years old, and when I was younger, there was no way to take care of some of these health issues or get help for some of these health issues that I had no idea were affecting me so severely. My mom was a single mom, and my dad, when he passed away, didn't really leave us with anything. He didn't leave us with health insurance. He didn't leave us with life lessons. He didn't leave us with life insurance. He left us with nothing. So, as I got older and I started suffering from certain conditions, from being really obese to having really bad allergies, really bad sinuses, having my first sinus surgery when, around 20 years old. And I've come to realize that the quality of health insurance matters as well. My mom, we lived in a trailer park, so I'm used to food tickets. To go eat lunch, I'd have food tickets. To go to health insurance, we go to the local free clinic with a free doctor. And it's definitely better than nothing. When you have nothing, it's definitely better than nothing. As I've gotten older and I've grown into a career that's allowed me to pay for better quality health insurance, I've been surrounded by different levels of doctors. And through my journey of trying to understand health better, trying to fix the things that I am debilitated by. For example, I've suffered with sinus polyps and nasal congestion and allergies my entire life. Nothing that's causing me immediate terminal illness. And I can relate to that because my father died of it in front of me with terminal illness. I'm surrounded by illness. My sister has polio. My mom, 70 years old, I take care of her, and she has high blood pressure, cholesterol, diabetes, all these things that I see myself if going down a path of if I don't take care of my health. So I've made it a priority to try to fix these conditions of mine. And I work on it every day. And certain conditions I can do my best with. I can try to eat better and I can try to exercise every day. Those are the things I can do. But there's other conditions that I really have struggled with and gotten minimal results. Sinus polyps and surgeries have been a big part of my life, and so is the curiosity for it. I enjoy talking to doctors and learning about my conditions, learning about the positive, the negative, learning about all of that stuff, so that I can do a better job as a patient. Because it's important to have a good quality doctor, but also a good quality patient. I want to be that patient. This podcast is about sinus infections, sinus problems, sinus polyps, allergies, and how these conditions affect a human being. My goal of the podcast was to maximize the value and time I have with Dr. Naveen Bendarker. Dr. Bendarker has been my surgeon and my sinus condition savior for a few years. He's board certified in otolaryngology, head and neck surgery, with a specialty fellowship training in endoscopic sinus and skull-base surgery. He's a sinus guy. He's a very renowned doctor from the University of California, Irvine. Dr. Bendarker, he treats all types of ENT disorders, but he specializes in medical and surgical treatment of all disorders related to the nose and sinuses, and with a special focus on nasal polyps. Usually this podcast is about life lessons, about poetry, about philosophy. This episode is educational in nature. Its goal is to make us better quality patients. For those that are suffering with these conditions, anything from sinus problems to deviated septums to allergies, people who are suffering with these conditions, this podcast will be beneficial to you. My conversation with Dr. B lasts about an hour, and I wrote out specific questions to go over specific things, such as the anatomy and physiology of the sinuses, to the treatments that we have now and in the future, to how the sinuses affect our voice, what parents can do for children that may be suffering from this condition. Everything from sinus infections to sinus headaches. I really respect Dr. B and I appreciate him because he's very well spoken. And hopefully I can do a podcast and we can with him in the future where we talk about the life lessons, the poetry and philosophy and his art. His art is helping people who suffer with this condition, one I have a great respect for. So I hope you enjoy the podcast. Sit back, relax, and if you get any benefit from it, share it with someone that may be suffering with these conditions. Because we go over a lot of things that may help you at least find some peace and find some alleviation from all this suffering that may go from this unnoticed illness. At the end of the podcast, you'll be able to get some information on how you can make an appointment with Dr. B. And in the show notes, I'll make sure to include his contact information. I hope you enjoy it, and thank you for allowing me to share it with you. Dr. B, thank you very much for your time today. I greatly appreciate it. It means a lot to me, and especially the listeners in the voiceover community and others alike who may be suffering with everything from sinus infections to nasal polyps and maybe some of these allergies. And I have a list of questions here that I think would be beneficial for anyone listening regarding these issues. And I'd like to start off with just the anatomy and physiology of the sinuses. So if you could maybe give me some insight to exactly what are the sinuses and how many do we have?
And first off, Kabir, thank you so much for the opportunity to talk about all this. It's really something I hold dearly to my heart to be able to educate people on all of these issues that we're going to discuss today. So I really appreciate the time that you've taken and are putting into making this happen. But going on to the subject matter, so what are the sinuses? We know that sinuses are normally air-filled structures in the face, and we have 4 pairs of them on either side. So we have what are called the frontal sinuses that are in the forehead. We have the maxillary sinuses that are in the cheek. We have the sphenoid sinuses, which are all the way in the back, in or around behind the eyes. And we have the adenoid sinuses that are a number of air cells between the eyes. So being normally air-filled, they have the function of various aspects of physiology. So one of those is filtration. Sinuses produce mucus and function in normal defense mechanisms against organisms such as bacteria and viruses. They also function in shock absorption. It's thought that the air-filled cavities in the head protect us from injury in the event of impact. They do have a function in voice resonance, which I think is very relevant to what you do. So the amount of pneumatization or air development in the sinuses can affect how our voice sounds, just even at baseline. And so those are a number of the more commonly discussed functions that sinuses have.
That's great. Thank you for breaking it down so beautifully. The next question I would love to know is one issue that I'm currently suffering with, and I'll be having my surgery January 5th, is regarding the deviated septum. If you can help us understand, what exactly is a deviated septum, and what role does the deviated septum play in the health and wellness of sinus cavities and sinuses in general?
Yeah, that's a great question. I think it's important to first understand that the deviated septum is an anatomic problem related to one specific structure, the septum. The nasal septum is the dividing line between the right and left sides of our nose. So what deviated means is that it's crooked, and it can be crooked to one or both sides. Now, directly speaking, it doesn't affect how the sinuses function, but it can affect access to the sinuses with respect to airflow and delivery of of medications that we may use to treat problems with the sinuses, most of those medications are best delivered directly to the sinuses topically, is how we term it, which means they're surface delivering medications that we want to get to that target site deeper in the nose, and deviated septum can certainly obstruct our ability to get those medications back there, which then secondarily can affect how the sinuses may behave or function.
And that's again something that I find myself, because my deviated septum is in the right sinus, or the right nasal passage, and I find myself many times flaring my nostrils or opening them up just to deliver, say, saline or a nasal spray a little bit better into that deviated septum. And I'm looking forward to correcting that deviated septum so that, the medicine can reach the places that it really has a difficult time reaching now. So thank you for breaking that issue down for me. And part of that deviated septum surgery goes into our next question about turbinates, because I'm also getting turbinate reduction. And I would love to know just what are turbinates and why do we even have them?
The turbinates are another normal structure in the nose, like the sinuses and the septum, and it's not really well known, as you're asking, what exactly they do. And so we have a number of turbinates in the nose. The ones that we commonly refer to when discussing turbinates are the inferior turbinates, so those would be the lower ones. Not to say that they're any less important than the other ones. They're just named for the position in the nose. So there are also the superior turbinate and the middle turbinate above that. The superior turbinate and the middle turbinate relate more to the sinuses and where they drain, whereas the inferior turbinate functions more in the nasal airway. So the reason that the turbinate reduction would be needed is because the inferior turbinates are also a component of that blockage, and being a component of that blockage, the way they do that is they get swollen. So when they get swollen, then we'd want to reduce the size of them. We don't want to cut them out. It would seem that would be the best way to deal with them, but it's actually the worst way to deal with them, because your other question about why do we have them, the physiology of these structures is extremely important. So the inferior turbinates function in nasal airflow regulation between side to side. So there is a process called nasal cycling, which is under nerve control from the brain, that signals to our nose to congest and decongest on either side at any time. It's thought that the airflow itself is somewhat traumatic to the nose, and you can imagine if you're breathing through one side all the time, that can potentially result in drying. So what the nose is doing, it's a lot smarter than we give it credit for. I think it's basically regulating airflow between the two sides to repair and protect while humidifying the air that we breathe in adequately, so that it reaches the lungs in optimal shape and ready to deliver that oxygen for gas exchange. So without turbinates, we wouldn't be able to do that, which is why when it comes to reduction, we really want to be directed and careful in how we do that, and just do enough that they take less space in the airway, but not so much that it would cause a problem with physiology.
Wow. And these turbinates, they can inflame or deflame at any time, just given whatever affects them, maybe pollen or allergies, etc., mucus. They're just self-regulate like this?
Well, so the self-regulation occurs naturally even in people without inflammation. When you throw in a trigger like allergies or even chronic sinus disease or polyps, other things that cause swelling in the nose, then the cycling becomes less pronounced, in the sense both sides get swollen at the same time, and then the intervention that we're doing for the turbinates is in part to restore not only nasal airflow but also that normal cycling from side to side. So there's definitely an art to that.
Wow. And now a nice pivot to our next question, which you just mentioned, was something that I've suffered from and have had surgery multiple times for, which is what are sinus polyps and how are they created? And how is it different, if at all, from, say, one of the most more dangerous things we think about as non-educated patient would, like myself, would say a tumor? Are they the same thing? Are they a different thing? What is a sinus polyp?
First of all, I have to disagree with the non-educated part of that. I think you are probably more articulate and more educated than most people. You ask very good questions, and the way you ask the questions shows a lot of insight. So I'm just going to throw that out there.
Thank you, sir.
But I think the most common polyp that people understand is probably that arises in the colon, because as we get to a certain age, we have to go through screening. There's genetic factors associated with colon polyps, and colon polyps are classically known for being so important to diagnose because they have the ability to become or may already be cancerous. So it's really important to make that distinction between sinus polyps, where these are purely inflammatory and unrelated in all ways than when we consider tumors. They're not at all neoplastic, which is the term we give for benign or malignant, aka cancerous tumors. They are still growths, but they're inflammatory growths. And so it's the underlying molecular inflammatory cascade that's causing them to develop, in the sense that everybody with sinus polyps has chronic sinusitis. They have that underlying inflammatory problem in there, but not everybody with chronic sinusitis develops polyps. So yes, your situation involved those polyps, and that basically is an effect of long-standing inflammation in the sinuses, with a molecular cascade that causes certain inflammatory cells to be brief and direct about it in a way that I think is easy to understand. These inflammatory cells are basically coming in and causing a number of inflammatory cascades on a molecular level that we can't see that cause these polyps to grow. So what that means is the more poorly controlled the inflammation is, the more potential there is for the polyps to grow. The better controlled the inflammation is, we can get them to shrink and we get them to stay well controlled.
Wow. I know inflammation itself is a separate beast of a topic, and it kind of goes into my next question about nutrition. I know, to my knowledge, a little bit that nutrition can affect inflammation response in the body, but does nutrition affect our sinuses at all?
Yes and no. So and first of all, it may be important to define. I used the term chronic sinusitis, and we probably didn't talk about that so much yet, but I think it was sort of alluded to in the context of talking about what polyps are. But what we're talking about here is chronic inflammation of the mucous membrane of the sinuses, and we think of this. A lot of people think that sinusitis is an infectious issue. Sometimes it is when it's related to viral infection, but when we talk about chronic sinusitis, we're really talking about an inflammatory problem. So the question there, then becomes, yes, are there foods that we eat, or vitamins or supplements that we can take that help our sinuses or hurt our sinuses? And so the big picture there is, I don't think we have all of the information on every single dietary factor that may affect sinus health. We do know a couple of things. Mucus composition is mostly water, so staying well hydrated and drinking a lot of water would help optimize the composition of mucus and the function of our nose and sinuses. There is one vitamin out there that is very important, actually, even as it relates to COVID, as an immune system defense mechanism and cofactor, vitamin D. So it is known now that vitamin D deficiency can negatively affect the sinuses and predispose us to recurrent sinus infections.
Wow. Yeah, that's amazing.
And there are a number of other foods and even beverages that one could identify that may be a problem. I think most people will know if they're sensitive to something because their nose will get a lot more congested afterwards. Their symptoms will get worse. They may even get a sinus infection. I've heard of people having sensitivity to beer, for example, or red wine has sulfites in it. So it could be that. There's a number of food allergens, gluten, soy, dairy, that could be a problem. And then there are a number of supplements out there that are commercialized and available that purport a potential benefit with respect to our sinuses. And I don't know that we have a lot of proof or evidence that they work. However, I would say if they seem to work and they're doing more good than any harm at all, then it may not really hurt to continue them. But honestly, I just don't think we have a lot of answers there.
Yeah,
I think what we know. Sorry.
No, please go ahead.
I was going to say what we do know is that having a well-balanced diet and eating healthy on a day-to-day basis and actually getting a lot of exercise, because exercise stimulates decongestion in the nose by a natural physiologic response. So, those are all good things for our health and are probably good things irrespective of the sinuses.
I can definitely testify to two of those things first-handedly about if I have a glass of wine or a drink, I almost within 30 to 45 minutes can notice a drastic change in my sense of congestion instantly almost. And I have experienced this. And with that, I've also experienced the beauty of exercising and getting a good sweat and how that can help in the decongestion of it. So thank you for sharing that insight. I think that's definitely very valuable.
I think we all have to decide if we're going to have the joy of that glass of wine and suffer the misery of consequences, right?
Absolutely.
Maybe it better be a good glass of wine.
It better be a really good glass, absolutely. Going on to the next question. If you can help us understand the effects of some of these triggers you've mentioned, everything from dust and pollen that we can consider allergy triggers, that the effect that it has on our sinuses and I guess indirectly on our voice, and if genetics plays, if any role in this.
So we do know that allergies affect the sinuses. We also know that they're not the sole cause of sinusitis. So being a chronic inflammatory problem, it exists by itself, but allergies can certainly be triggers. And so if allergens are getting in the nose and causing an inflammatory response in the nose, they can certainly also cause the same inflammatory response in the sinuses and cause a flare-up of that inflammation. And so how the voice relates in all that is probably somewhat both direct and indirect. So the direct effect on the voice is allergies can also affect the throat. And so if we get inflammation in our throat because of the allergies, there's mucosa in the throat, there's mucosa around the voice box. That area also gets inflamed and then can immediately be impacted. The indirect effect comes when the allergies in the nose start to cause excess, or even in the throat start to cause excess mucus production, and then that mucus starts to drip down in the back. We term that postnasal drip, and it falls down to the throat and the voice box, and then our voice is affected just by virtue of having to feel like we have to clear it all the time, and feeling like something is stuck there. Now, it's important to also identify that acid reflux is a common cause of that same problem. So when it comes to trying to figure out which one of these allergy, reflux, or sinusitis is going on, it takes a careful evaluation by an ENT specialist. But those are kind of some of the ways that all of these things tie together. And genetics have a huge role when it comes to allergies. If you have no family history of allergies, the natural prevalence or chance that you would have allergies just in the general population is about 1 in 6. With the one parent that has allergies, that doubles to
Wow.
1 in 3. And with two parents that have allergies, you got a 50% chance. So there's definitely a huge genetic component to at least that. Chronic sinusitis probably has a genetic component that we haven't quite been able to identify yet. We're starting to understand more and more the molecular problems associated with sinusitis, but I think it's going to be a little bit of time before we can identify familial transmission and relationships there.
That's very insightful. Thank you for sharing that information. And as we move to hopefully the better part of this discussion is the treatments and what potential sufferers can do to alleviate some of these treatments. And I know one very popular treatment that I myself use, and you hear many people on the internet speak about, is the Neti Pot, and just similar tools such as the Neti Pot. What exactly is the Neti Pot and that daily sinus rinse about? What is it doing for us when we do use these tools?
So, incidentally, the Neti Pot came from ancient Indian culture as a mechanism of cleansing the nose. So people were doing this long before it became commercialized in any developed country. And I have to admit, and you may feel the same, of being of a similar culture, one would wonder if you or I had developed that billion-dollar industry, we'd be in good shape right now, right?
Absolutely.
But I completely support it. I think it makes a lot of sense, and I think to put perspective to that sense, it's important to identify why it works. And so the nose and sinuses have mucosa that has mucus production capability, but there are also, on a microscopic level, there are tiny little hair cells on the surface of that lining that beat to clear that mucus. And so we know what nasal and sinus rinsing does is stimulate those little hair cells to beat faster. And so in chronic sinusitis, when there's inflammation and those little hair cells are kind of stunned and not working as well, the sinus rinsing helps stimulate that as a natural remedy to clear that mucus out and help us get better, potentially even without other prescription treatment. So it's really an important first line treatment in chronic sinusitis.
Yeah, I can testify to that too, because with your guidance and constant telling me to do sinus rinses, it really does help. Like especially if I'm outside exercising and I get a lot of allergy triggers, and when I'm around parks or trees and grass, I find it always helpful. Even after a barbecue that has a lot of coal and the smoke, to just go in and do a quick sign, almost like just brushing my teeth. To do that once, twice, 3 times a day, even, it really helps a lot, and I've noticed the benefits of it. So I think that was important, and thank you very much for sharing that aspect of that treatment.
You're right on. I think you mentioned a really important part of this is the adherence to the regimen and the value of that, and washing all those allergens out. And I like the analogy to brushing your teeth. I have to say I do feel like your dentist sometimes, right? The first question that I ask you is how many times a day are you rinsing? Come in, right?
Mm-hmm.
Just like the dentist will ask you.
Yeah.
And then you always tell me the hygienic answer. You do a good job with rinsing your sinuses out, which I think attests to why you've been doing so well.
Yeah, absolutely.
So a lot of this is based on the patient's I guess aggressiveness and adherence to all these treatments.
Absolutely. And speaking of these treatments, and this is a short question, and you may have any opinion or none about it, but have you heard of any of these non-medication treatments like iodine rinse for the nasal cavity or anything of that aspect?
There is some research going on right now, and actually there's already knowledge out there that iodine, being an antimicrobial, will eliminate COVID.
Wow.
Or the virus that causes COVID. So the SARS-CoV-2 virus, amongst another host of microorganisms. It's actually used quite commonly in sterilization protocols for surgeries and procedures. So there is definitely a role for betadine and iodine. I'm honestly not certain about regular daily use.
Mm-hmm.
I think what we've used it for in healthcare is circumstantial, related to a specific type of treatment. I'm not sure that it would be healthy or tolerated to use it regularly. I think we just don't have the evidence or information on that yet. It very well might be something that arises later in certain forms of delivery. I just don't think that we should be doing that routinely now. I have, even for procedures, I have had people that get a small amount of burning just from the iodine hitting the mucosa, like rinsing your mouth with Listerine. So I don't think we're quite there yet, but there is definitely a role for iodine, betadine, when it comes to decolonizing the nose.
Perfect. Okay.
Situation. Yeah.
Oh, thank you for that insight. If you can, please help the viewers and listeners understand maybe a little bit about the condition that you've seen me in, and how is it that you treated me and helped me, because you've changed a lot of my life in ways, that I'm very grateful for, in terms of relieving me from the suffering of, everything from nasal polyps and chronic conditions that I have. So maybe just a brief description of what you saw in my condition and what it is you did to help me.
Yeah, I'm so happy to hear about how you're doing every time. I just can't hear it enough, because there's honestly no greater reward to me than somebody whose life has changed as a result of what I've done for them, of the way that I've touched their life, and there's 10 years of practice and going. There's just so many people out there. I just feel so blessed to be able to help everybody like that. But when we look through your history, the previous surgery and the persistent polyps and all the symptoms that you were having, clearly you had a very severe form of disease, with the amount of inflammation and the polyps and the sinuses being blocked. So I think what we did there, and what I do for everybody, is we have to take a step back and look at the big picture. We have to understand that what we're dealing with is a biological problem, not a a curable problem with surgery. And we have to think of the surgery as a step in treatment. And the important step in treatment it provided here was access to all of the sinuses so that we could treat them topically. We were talking about those treatments earlier, topically with the medications that are needed to keep them under control. And that's what we were missing when I initially saw you. We needed a way to get those things in there effectively.
Understood. And, some of these treatments, my most recent ones, I'll combine these next two questions because they're very well related, is my most recent treatment was a very gnarly experience for me, which was the balloon sinuplasty. And if you can maybe just expand on what exactly that was and versus maybe some of these other treatments, and then pivot into some of these topical treatments you mentioned, everything from what I currently use from Nasonex and what I've used in the past, such as prednisone and, other forms of Flonase. I would love to hear just a little bit about that.
Right. So the balloon that we used in this situation was really to reopen the area of the frontal sinus, the forehead sinus, where polyps had reformed and the ability to deliver therapy up there was being limited. So what we successfully did there now in retrospect, because I've seen you back in follow-up, is we used the tool, the balloon, as a dilator device to reopen the pathway. And then we had a steroid-eluting implant that we placed at the same time that allowed us to deliver the anti-inflammatory medication directly to the target mucosa around that opening. And it resulted in significant reduction and almost elimination of the polyps. So the reason that was even feasible at this point is because we did a comprehensive sinus surgery initially, and we had the opening, and we were really just dealing with narrowing due to inflammatory tissue. So all of these treatments that we're using for sinus problems kind of focus on two core concepts: access and control of inflammation. And maybe there's a third one there to remove the inflammatory tissue. So we did remove some of those polyps at the same time. But that's really what we kind of look at over and over again. Every time you come in and we're looking in the sinuses to see how we're doing, we're looking for inflammatory control. We're looking for maintenance of access, and we're looking for any signs of recurrent polyps. So we have to decide at any point in time if there's recurrence on how we're going to deal with it. All these topical steroids that we use function in slightly different mechanisms. And so if you go through kind of the ladder of actually, we can go through the ladder of all steroids. So at the top, the most powerful and effective are things like prednisone. That's where we're giving you tablets to take, usually in a tapering course. And we give that when the inflammation is diffuse, meaning all over the place, pretty bad, and we've got to hit it hard quickly. And that's usually the quickest way to do that. So when you go down from there, then we have other things like nasal sprays. We have steroids that we can put in those Neti Pot irrigations, saline irrigations, and we have implants that can deliver different amounts of steroid to the sinuses. So basically, all the topical steroids will work by directly delivering to the mucosa, whereas prednisone is going to work by delivering it through the system, through the bloodstream to the mucosa. Which topical steroid we decide is really going to depend on the pattern of inflammation and what we need to do to accomplish the treatment at that point in time.
Yeah, that's great information, and I can testify that, the balloon sinuplasty combination with the implant and the Nasonex has really improved a lot of my sinus headaches and the pressure that I was feeling. It's drastically improved it, and I know that the daily rinses will keep those, hopefully keep those passages open, and it won't go to that place again. But if it does, that procedure was very, very helpful. And you know, for people that have children, and some of these may be more scary surgical treatments for them, what advice or what can you what type of treatments can children go through if parents are seeing the signs of some of these problems? Everything from a little bit of allergy to, oh man, they might have some sinus headaches or sinus issues. What can children do?
So there's a point in development where the sinuses really do become a problem, and children may very well end up having chronic sinusitis, just like adults do, and end up needing procedures to control it. But in children, I tend to be a lot more conservative and go after the underlying causes much more aggressively because they do tend to have more common issues with allergies in particular, and that being the case, it's very important to focus on that before we do anything else. In the sense that what I've seen, at least, is that the allergies seem to be a much bigger confounding factor when it comes to what they refer to as sinus problems, and it may just be that in many cases, and not a sinus problem. It could be both, but it definitely makes sense to treat the allergies really hard first. Whereas if we're talking about an adult who has the same symptoms and same problems, they've probably gotten to a point where it's been going on a longer period of time, and we do still treat first with medications. We still do want them to get evaluated by all the medical specialists, but the threshold to surgery may be a little bit lower than it is for a child. Part of that has to do with anatomy. Children, the sinuses are not fully developed, nor is the septum or even sometimes the turbinates, depending on what age. So it's really important to focus on anatomic preservation even more in that population because things that we do may affect future growth and development if we skip straight to surgery, for example. So we definitely want to consider it as an option when appropriate, but we want to make sure that we're looking at all the other factors. When it comes to what we can do, I think most of the treatments that adults would use, children can also use. The age, I believe, at which Nasonex is FDA approved is 2, and Flonase or fluticasone is at 4. And those two are very common topical anti-inflammatory treatments, topical steroids that kids can use in the nose if they have problems with allergies and swelling, sinus problems. So that's really kind of the first thing, along with the saline that we were talking about earlier and allergy medications, getting them to the doctor to make sure they get thoroughly evaluated, having allergy testing done if appropriate. And when it comes to looking at the sinuses, we know that CT scans and X-rays are associated with a certain amount of radiation. It's not a terrible amount, but it's more than what we should really consider early on for a child. If we're trying to minimize that, I would treat fairly aggressively before we get a CT scan. So that's sort of the algorithm. So it's not really a ton different from adults, maybe slightly more conservative overall.
Perfect. Thank you very much for that. As we move on to the next section, here's a little bit for the voice acting community in specifics, and you did mention a little bit how the sinuses affect the voice. The next questions are just going to be combined into wondering what can voice actors do to help keep their sinuses healthy, and if they get in a critical situation where they're feeling congested, and I've been in that where I'm in a studio session and I'm sounding a little nasally, what can they do to maybe get some relief from that? Is there any insight you can give us?
Absolutely. So I think this is a really good topic because it sort of combines some of the things we've discussed earlier to summarize and put it all together into practical use. So one thing we had talked about was the effect of water consumption and hydration on mucus quality, and I think that is probably, I can't attest to it. I should say because I don't claim to have a voice of any professional quality, but I can attest to the fact that when I don't drink enough water, my voice tends to sound a little more raspy or hoarse because the mucus is thicker, and that happens to all of us, even in the absence of sinusitis. So I think water intake, adequate hydration is really important, and that's one thing. It'll keep the sinuses healthy by keeping the mucus of normal quality for clearance purposes. Now, if you have chronic sinusitis, that's a different story. I think here we're just talking about what can we all do on a day-to-day basis to make sure that we're optimizing function of the nose. But if you do have a problem, prednisone again, I think that's going to be the fastest and probably most effective way to treat a flare-up of inflammation. Decongestant can help because it'll open up the nose, but decongestant may not help that much if the sinuses themselves are inflamed. It'll help you breathe better, and it may change the quality of your voice because of breathing better. But I think the prednisone is probably what is going to become necessary if we're in a pinch. And prednisone, being anti-inflammatory, will hit inflammation in the entire upper airway. So we were talking about how allergies can affect the throat and voice box. Prednisone can potentially treat all of that. I wouldn't necessarily say it's perfectly safe. Most people tolerate it just fine, but there are important potential side effects of prednisone that everybody should be aware of course, before taking it. And I think that may be beyond the scope of this, but it's always important to read package inserts and talk with your doctor about any therapy, of course, before starting it. But I would say in the case of prednisone and the situation you're describing, definitely benefits outweigh the risks.
And man, I will testify as someone who's used prednisone, does not like the medicine at all because just the way it makes me feel, but can testify that it really helps a lot. And I've seen it help really quickly. So yes, absolutely the best advice to speak to your doctor and know the risks involved. But it really has helped me when I needed it. And, thank you for shedding that light on that. There's an interesting thing that happened. I went to Thailand, and on the plane, when I was in the plane and going there, there was extreme pressure in my sinuses, so much so that I had to keep pressure on my head and just try to, keep myself from crying because of the pain. And when I landed, the first thing I did in Bangkok was go to the hospital. And in the hospital, they checked me out and they saw that my eardrum was a little ruptured. And they also saw, that I had maybe some sinus infection or headache. And they gave me, I believe, Sudafed and a little nasal spray. and I had to take that while in Thailand, and it helped a lot. But I haven't really experienced that type of pain from that air pressure in my life, man. It was a lot. And if you can shed some light on some of these, from everything from a sinus headache and how pressure affects, along with ear pressure and how that affects maybe the voice. And I know a big part of this might be sinus infections.
Yeah, and that's one of the terrible situations that people describe. I think anybody that's experienced that can attest to what you described, myself included. I've had that before, and I think if I understand correctly, it was during the descent.
Correct.
And that's usually when it's going to happen. So, can I ask, did you feel like your sinuses were flaring up at the time?
A little bit, yes.
So in that situation, when there's more inflammation, what's happening is the sinuses are getting blocked, and that same inflammation was probably causing the equalization system of the ear, the eustachian tube, which connects the throat to the ear space behind the eardrum, to also get blocked. And so the ear and the sinuses obviously function very differently, but the concept here is sort of similar, that when you're in the pressurized cabin up in the air, everything's fine. When you go through descent and there's the depressurization, that's when these symptoms start to happen, as the blockage of the sinuses, the blockage of the ear space, isn't communicating with the outside atmospheric pressure, and then you get the excruciating feeling like those areas are about to explode, because they're basically they're pressurizing in your face.
Wow.
And in your ear, and that's what resulted in the eardrum rupturing, because the pressure got so high that the eardrum could no longer withstand the force.
Yeah, that just you talking about it, it's taking me back to such a painful place, because I felt so. Yeah,
You and me
man,
both.
it was really, really a unique experience, and that gives me some great insight into how the pressure can be affected. And do sinus infections, are they caused by anything in particular? Is a sinus infection bacterial or viral, or?
It could be a little bit of both. Usually, it's going to start viral, and then the bacteria set in later as a secondary event. But in people who have baseline, or all the time they have chronic inflammation, that chronic inflammation by itself puts them at risk for bacterial infections just developing up front. So it could be a little bit of both. And if you think about, you mentioned that you may have had a sinus flare-up, maybe even had a sinus infection at the time you went up in the airplane, maybe one that wasn't necessarily diagnosed yet or didn't know about, just felt some symptoms that were worse than usual. Those are situations where if maybe next time you can supersede the issue by potentially using those same treatments that they gave you on the ground for preventative purposes. So using things like decongestants, or even starting a course of antibiotics if appropriate, or prednisone. Some of those things can be very effective for treating inflammation right on the spot, and clearing out whether it's infection or inflammation before you go up in the airplane and end up in that situation during descent.
As much as I disliked some of the prednisone, man, I will keep it by my side if I ever fly again. There's no way I want to experience what I experienced, and that already gives me at least some sort of plan, an action plan before traveling or going on a 18-hour flight. That okay, treat your infection accordingly before you feel this insane pain. So thank you for that.
I feel so bad for you. That's the last way you would want to start a trip like that.
Yeah, yeah, it was very unique and memorable, but thank you for shedding light on that. And as we wrap up this conversation, I would just like to ask you, what can patients look forward to in the next 5 to 10 years with regards to innovation in the field? Anything from maybe some of the treatments or some of the new discoveries that are being made? Is there anything you can give us in terms of those?
There's been a lot in the field of chronic sinusitis that was developed even in the past 3 to 5 years. So actually, we were talking about these steroid implants. Those are relatively new. I think we've been using them at UCI since probably around 2014, maybe 13. And so that was really a huge technological advance, the ability to directly deliver drug to the target site where it matters the most. So that concept is continually being expanded upon. Subsequent to that, there's a medication called Xhance, which is FDA approved for nasal polyps, which came out in the last 2 to 3 years, and it's shown to be quite effective at keeping polyps under control, even in the setting of post-surgery, and maybe even more so because now, again, as we discussed, we have the cavities open and ready to receive that anti-inflammatory medication to improve the treatment. So looking forward, there's more innovation in the field of topical steroid delivery. Xhance was so revolutionary because it took steroid from a delivery mechanism of a traditional nasal spray where we press on the device to spray the medication in our nose to one of exhalation into the device, then propelling the medication into the nose in a much more diffuse delivery pattern. So that concept is important to understand because the directed drug delivery is really the focus and important aspect of all of these treatments that are being developed. So there are different steroid implant type devices that are being developed that can potentially be placed in the nose before surgery, because the ones that we have right now are primarily for use after surgery and specific types of surgery procedures, depending on which sinuses we treated. So that's one thing that's kind of on the horizon right now, which I'm looking forward to get into my hands. I think the big thing right now is targeting the inflammatory cascade itself directly, and that concept is probably equally important, or if not more important, than directed drug delivery. But it focuses on medications that have targeted the molecular biology, the inflammatory cascade directly. And so instead of treating the effect of inflammation with topical steroids, we're treating the root cause of that. And we're starting to get into the molecular genetics and all that of sinusitis. So some of these treatments are already available. The most recent one to be approved, I believe, was dupilumab or Dupixent. And what all these medications sort of have in common is that they're antibodies, molecules that basically target a specific site of that inflammatory cascade and try to shut it off, basically. And so I think that knowledge and continued research into the molecular aspects of this disease process is going to be very important in further treatment. So I think what we're going to see in the next few years is different targets being developed that may potentially treat different situations, because not everybody with sinusitis is the same on a molecular level. There are some common things that we see from patient to patient. But what we may see in the future is better ability to type, if you will, what's going on a molecular level and target treatments towards those molecular abnormalities that are causing the inflammation to develop. So I'm really excited about that. One thing we don't have right now in terms of topical treatment, we prescribe, and I think you've used yourself on a number of instances, antibiotics in saline rinse as topical treatment. And we've got steroid that we're putting on implants right now. Maybe at some point in the future there would be an option for antibiotic-eluting implants, perhaps. And that's something that some of these companies that have already developed implants may be in a good situation to focus on. Yeah,
that's definitely very insightful, and thank you for sharing that insight. I would like to say, first and foremost, man, I greatly admire and appreciate what you do, because it really does directly help, alleviate some of the suffering, if not most of the suffering, that people like myself may face. Anybody who suffers through these conditions, and it directly improves our lives every day, and for that I'll always be grateful. And to me, you like I said before, that this is your art, this is your creativity, and the beauty of it is definitely appreciated, man. And I couldn't be more thankful for your time today and sharing all this with us. And I will go ahead and make sure to, in my show notes, to put all your contact information and ways for people to connect with you. But what is the best way for new clients to get a hold of you, and if they're interested in booking an appointment?
So I think as especially with the issues with COVID and enhancement of online access platforms and web services, we've got actually a pretty robust website request system now to get an appointment, including telehealth appointments. Telehealth, we offer the full range of services for that. It is a little bit limited in the sense we can't do a physical exam, but for people that are concerned right now about coming into the offices for any reason, we do offer that. And the best way to request any of those appointments, in my opinion, is to go through one of our websites. We've got the main department website, which is UCI Head and Neck. The "and" is spelled out, UCIheadandneck.com. And there's a subpage for me, Naveen Bhandarkar M.D.com. So either one of those will allow requesting an appointment with basic information, and somebody usually will get back to anybody requesting within, I've heard within the same day, if not within a few hours, to explore the symptoms and get some background information and get things squared away. So I would say that's definitely the easiest. There's a phone number on that website that one can call to also request an appointment.
Perfect. Thank you very much for this amazing opportunity and sharing your professionalism, your craft, and your art with us, man. I greatly appreciate you and forever will, man. Thank you.
I appreciate the opportunity once again. This was a lot of fun, and I hope you and everybody that listens to it will learn a lot from it.
I just want to say thank you very much for those that took the time out to listen to this educational podcast with Dr. Naveen Bendarker and myself. We really appreciate it. And if you find any of this information helpful, please share the podcast with a fellow voice actor or anyone in the community, along with friends and family that may be suffering with allergies or conditions alike. For those looking for a virtual consultation or an appointment with Dr. Naveen Bendarker, you can check him out at ent.uci.edu. Naveen, N-A-V-E-E-N, Bendarker, B-H-A-N-D-A-R-K-E-R. And if you'd like to follow me or check out any of my YouTube content or any of my website content, you can check me out at KabirsVoice.com. KABIRS voice.com. Thank you. Have a blessed day.